Dr. Richard Thornton barely lifted his gaze when the temporary physician entered the surgical planning chamber. His attention stayed locked on the diagnostic images spread across 3 displays, revealing the complex blood vessel network of a patient scheduled for afternoon operation. "You're the temp," he stated, his tone carrying that distinct note of dissatisfaction saved for unwanted developments. "We particularly requested somebody from Johns Hopkins." Dr. Elena Vasquez shifted the electronic tablet beneath her elbow, with movements that were efficient and rehearsed. Her dark brown eyes absorbed the chamber rapidly, cataloguing the arrangement of seats, the placement of the displays, the doorways, ingrained reflexes. "My qualifications were approved by your committee, Dr. Thornton," she answered softly, her tone measured, yet not combative. Thornton eventually glanced up, observing the woman positioned before him. Mid-30s, he estimated, dressed in plain navy medical scrubs that appeared like they'd survived countless laundry cycles. No accessories, aside from a military-grade timepiece on her left arm, the type armed forces members wore. Her raven hair was secured in a low, secure bun that exposed small scars throughout her hairline. Chemical burns, perhaps, or fragment injuries. "Approved doesn't equal desired," Thornton remarked, redirecting his focus to the images. "This is St. Michael's healthcare facility. We maintain benchmarks that transcend simple qualifications." He motioned toward the meeting table where 6 additional physicians sat. All male, all observing the interaction with different degrees of curiosity. "You'll be handling standard procedures for the upcoming 3 months, while we finalize our organizational reshaping. Dr. Park will familiarize you with our guidelines." Dr. James Park, a heart surgeon in his early 40s, acknowledged from his spot beside the glass. His demeanor was impartial, businesslike, yet Eleanor detected how his vision remained on the marks apparent on her palms as she placed down her tablet. "Welcome to St. Michael's, Dr. Vasquez. We operate a rigorous establishment here. Guideline-focused, research-supported healthcare. Dr. Thornton has sustained a 94% achievement rate in chest surgery for 15 years. "That's remarkable," Elena commented plainly. Her digits navigated across the tablet display, accessing the day's surgical roster. "I notice I'm allocated to operating room 3, beginning at 1600 hours. A valve substitution," Thornton stated dismissively. "Standard. Even a temporary should manage that without difficulties." He pivoted to address the remaining physicians. "Gentlemen, let's proceed with the morning overview. We have 6 operations scheduled, and I wish to review the Martinez situation." Eleanor shifted toward an unoccupied seat at the distant edge of the table, yet something prompted her to stop. Her vision had landed on one of the diagnostic images still shown on Thornton's display, the patient from operating room 3. She'd witnessed that specific configuration of calcium deposits previously in locations where imaging machinery wasn't cutting edge, where you mastered interpreting scans with more than merely academic knowledge. "Dr. Thornton," she started cautiously, "the valve substitution patient. Has anybody examined the rear surface of the rising aorta?" The chamber became silent. Thornton's muscles tensed noticeably. "Dr. Vasquez, the imaging has been examined by 3 supervising doctors, including myself. The situation is uncomplicated aortic valve narrowing with scheduled replacement. Your responsibility is to perform the operation, not to challenge our assessment procedures." Elena acknowledged gradually, creating a mental record. She discovered long previously when to challenge and when to watch. In her background, the latter choice maintained you breathing longer. Acknowledged. As the overview progressed, Eleanor discovered herself examining the remaining physicians. They yielded to Thornton instinctively, concurring with his evaluations, agreeing with his declarations. It was a power structure she identified, though not one she'd functioned under in years. In field medical facilities, position mattered less than outcomes. Here, in this spotless meeting chamber, with its cushioned seats and flawlessly regulated climate, alternative regulations existed. After the overview concluded, Sharon, a seasoned nurse who'd been positioned silently in the corner, reached Elena in the corridor. That required bravery, she mentioned softly, acknowledging Elena's inquiry about the imaging. Thornton dislikes being challenged, particularly not by provisional personnel. Elena was reviewing her tablet, accessing the patient's complete health history. I wasn't challenging, I was seeking clarification. Sharon examined Elena's palms as she operated, observing the delicate pale marks across both hands. Those resemble field healthcare burns, she commented. My boy's a Marine. The medics he serves with have comparable injuries. Eleanor's digits hesitated for merely a fraction of a moment before resuming. Some healthcare machinery operates hot in demanding circumstances, she stated impartially. She secured her tablet and encountered Sharon's vision. Where's the physician's lounge? I must examine this situation before operating time. Down the corridor, second entrance on the left. Sharon's demeanour was contemplative. Dr. Vasquez, I've laboured here 17 years. I've witnessed numerous physicians enter these entrances. You navigate differently than most of them. How so? Like somebody who's accustomed to labouring in locations where remaining stationary gets you eliminated. Sharon's tone was soft, yet confident. My boy discovered that in Afghanistan. Where did you discover it? Eleanor modified the timepiece on her arm, an automatic motion that communicated checking tactical timing in elevated stress circumstances. Background instructs us all alternative teachings, she stated eventually. Appreciate the instructions. As Elena departed, Sharon observed her proceed. The manner the younger physician navigated through the passageway wasn't arbitrary. She was cataloguing exits, recording camera locations, sustaining consciousness of everybody surrounding her. That wasn't civilian healthcare instruction. That was something altogether different. In the physician's lounge, Eleanor discovered a secluded corner and accessed the diagnostic images from her afternoon patient. She magnified on the rear aortic surface, modifying contrast and luminosity. There, that subtle abnormality that the remaining doctors had overlooked. It could be interference from the imaging device, or it could be the commencement of a separation that would convert a standard valve substitution into a life-endangering crisis. She created thorough records, cross-referencing with comparable situations she'd witnessed. Not in academic texts, not in distinguished teaching medical facilities, but in locations where imaging devices operated on unreliable generators, and you mastered interpreting scans by what they didn't reveal as much as what they displayed. Her device vibrated, a communication from an unidentified number. Discovered you accepted a role at St. Michael's. Observe your surroundings. Thornton's standing isn't merely about achievement percentages. Some of us attempted to introduce new approaches there. Didn't conclude favourably. Previous associate, Doctors Without Borders. Elena erased the communication and redirected her focus to the images. 3 months, she reminded herself. 3 months handling standard situations, remaining unnoticed, preventing difficulties. Then she'd transition to the subsequent provisional role, the subsequent municipality, the subsequent medical facility where nobody posed excessive inquiries about the interruptions in her professional history or the marks she couldn't entirely conceal. Yet, as she gazed at that diagnostic image, at the subtle abnormality that could signify nothing or could signify everything, Eleanor recognized that remaining unnoticed might not be achievable. Not if that patient's existence relied on perceiving what others had overlooked, not if her reflexes, refined in locations where additional opportunities didn't occur, were communicating that something was incorrect. She shut her vision briefly, and for merely a moment she was returned in a canvas medical facility with explosive fire in the background, operating by the illumination of a battery-operated light, creating impossible determinations with restricted data. Then she accessed her vision and was returned in the spotless physician's lounge of St. Michael's Healthcare Facility, where the coffee was outstanding and the anticipations were evident. Stay in your path. Adhere to guidelines. Don't create disruptions. Elena glanced at the diagnostic image once more, then started preparing her records for their afternoon operation. because sometimes staying in your path meant observing people perish, and that was one teaching she'd never mastered accepting. If you wish to witness how this rebellious physician challenges every guideline to rescue existence everybody else abandoned, ensure you follow Emergency Medical Heroes Chronicles, because what Dr. Vasquez accomplishes in the upcoming hour will transform what's clinically achievable. Where are you observing from? Leave a remark and inform us, because what occurs in Operating Room 3 is about to alter everything at St. Michael's Healthcare Facility. The medical staff lounge resonated with the recognisable sounds of late afternoon, coffee preparing, keyboards tapping, the subdued discussions of depleted surgical personnel grabbing instances of relaxation between operations. Dr. Elena Vasquez had become a subject of conversation quicker than she'd expected. She's been here 3 hours and already challenged Thornton before the complete surgical squad, one medical resident was stating, his tone transmitting sufficiently to be detected, yet silent enough to sustain believable deniability. Either she's exceptionally courageous or exceptionally foolish. Dr. Amanda Chen, a third-year medical resident, looked toward the corner where Elena sat, examining patient documents. Did you notice those marks on her palms? Those aren't from Healthcare Academy accidents. They resemble field burns. My relative was an armed forces medic. He possessed comparable injuries from operating with cauterization machinery in forward stations. Perhaps she performed rural healthcare somewhere, another resident proposed. Volunteer labour in developing nations or something. Dr. James Park entered the lounge, prompting the residents' discussion to cease suddenly. He dispensed himself coffee and reached Elena's table. Dr. Vasquez, do you possess a moment to review the afternoon situation? Elena glanced up from her tablet, her demeanour impartial. Naturally, Dr. Park. Park positioned himself across from her, maintaining his tone subdued. That inquiry you raised in the overview about the rear aortic surface, what prompted you to observe that specific region? The imaging revealed subtle abnormality in the surface density, Elena answered, accessing the image on her tablet. Here at the connection with the rising aorta? It could be interference from the device, or it could suggest early separation. Considering the patient's background of elevated blood pressure and the calcium deposit configuration, I believed it merited reference. Park examined the scan, then regarded Elena with fresh curiosity. That's remarkably thorough observation for a standard examination. Most physicians wouldn't identify something that subtle on initial assessment. Most physicians haven't operated in locations where overlooking subtle particulars means losing patients you could have rescued. Eleanor's tone was factual, not arrogant. Where I instructed, you mastered perceiving what the machinery didn't reveal you. And where was that? Park's inquiry was informal, yet his focus was concentrated. Different locations, Eleanor shut the tablet, resource-restricted environments where you managed with what you possessed and mastered, trusting your reflexes as much as your machinery. Before Park could challenge further, Dr. Thornton entered the lounge. His attendance commanded instant focus. Dr. Park, Dr. Vasquez, I wish to explain the afternoon operation. The valve substitution is uncomplicated. Dr. Vasquez, you'll be primary physician with Dr. Park supervising. Standard aortic valve substitution guideline. The patient is 52 years old. Stable heart history beyond the narrowing. Simple entrance. Simple departure. Eleanor encountered Thornton's stare firmly. And if difficulties emerge, then you advance to Dr. Park instantly. Thornton's manner made it evident this wasn't a recommendation. This is St. Michael's, Dr. Vasquez. We don't create spontaneous solutions. We adhere to established guidelines that have been confirmed effective over 15 years of outstanding surgical results. Acknowledged, Eleanor stated softly. After Thornton departed, the residents resumed their discussion, though more softly now. She scarcely responds to anything, Amanda Chen commented. Thornton merely positioned her in her location, and she didn't even react. That's not surrender, another resident disputed. That's somebody who's discovered when conflicts are worth engaging. I've witnessed that previously in armed forces members. They select their instances. You believe she's previous armed forces? Those marks, that stance, the manner she catalogues every chamber she enters. Amanda shook her cranium. She's absolutely witnessed some circumstances beyond Healthcare Academy. In the preparation chamber at 1547, Eleanor readied for operation with systematic accuracy. Dr. Park accompanied her, watching her approach. You prepare like somebody who's accomplished this in field circumstances, he noted. Very comprehensive, yet efficient, wasting no duration or materials. Previous reflexes, Eleanor answered plainly. In some locations, liquid for preparing is valuable. You master not squandering it. Park commenced his own preparation. Dr. Vasquez, I wish you to recognize that despite Thornton's inflexibility, I maintain a receptive perspective. If you perceive something during the operation that troubles you, I desire you to communicate. Patient security exceeds guideline, Elena acknowledged. Appreciate that, Dr. Park. That signifies more than you might comprehend. They entered operating room 3, where the surgical squad was finalizing last arrangements. The patient, Robert Morrison, rested anesthetized on the platform. The sedation specialist, Dr. Lisa Patel, glanced up from her displays. Vital signs are steady. Blood pressure 130/80, pulse 72, oxygen level 98%. Prepared when you are. Eleanor positioned. Herself at the platform, her palms firm. Cutting instrument. The tool was positioned in her hand with rehearsed proficiency. She created the central chest incision with movements that were assured yet not hurried. Each cut was intentional, accurate, calculated. The surgical attendants exchanged looks. They'd operated with dozens of physicians, and something about Elena's approach was different. Not incorrect, merely different. More efficient, as if every action had been refined to remove anything unnecessary. Chest saw, Elena stated. The saw was transferred to her, and she separated the breastbone with flawless alignment. Minimal blood depletion. Academic manual flawless thus far. Dr. Park observed from his location, recording the proficiency. Excellent exposure. Proceed. Elena positioned the separator, accessing the surgical area. Heart covering entering visibility. I'm going to examine the aortic foundation before we advance with valve entry. That's not standard guideline, Park stated, though his manner was inquisitive rather than disapproving. We characteristically proceed straight to the valve. Accommodate me for 30 moments, Elena answered. Her gloved palms cautiously palpated the aortic material, navigating systematically throughout the rear surface. There. What is it? Park leaned nearer. Densification in the rear surface. Elena's tone was tranquil, yet determined. Early separation, precisely as I suspected from the imaging. If we'd advanced with standard valve substitution without addressing this, we'd have intraoperative rupture within the hour. Dr. Patel reviewed her displays. Vital signs are still steady, no indicators of acute separation. Not yet, Elena stated, her tone tranquil yet determined, yet the material integrity is jeopardized. Dr. Park, we must transform this to a valve substitution with rising aortic restoration. This patient requires more than what we scheduled for. Park hesitated. That's a substantial advancement. Dr. Thornton must be consulted. We possess perhaps 45 minutes before this becomes a crisis separation, Elena stated, still operating. With consideration, Dr. Park, by the duration Dr. Thornton prepares, examines the circumstances, and creates a determination, will be in emergency management instead of preventive restoration. How can you potentially recognize the schedule? Park requested. Because I've witnessed this precise manifestation 17 times, Elena answered, her palms never ceasing their cautious evaluation. 12 occasions in medical facilities with complete diagnostic capability. 5 occasions in field medical facilities where we identified it during operation. Every single one that we postponed addressing, concluded in crisis restoration with substantially elevated mortality hazard. The operating room descended silent except for the signalling of displays. Park regarded the exposed material, at Elena's confident palms, at the patient whose existence hung in the equilibrium. "This is your determination, Dr. Vasquez. Yet, if you're incorrect, both our professions are concluded." Elena encountered his vision. "I'm not incorrect, and this patient doesn't concern himself with our professions. He concerns himself with surviving." Park absorbed a breath. "Advance with the restoration. I'll accept accountability for the determination. And somebody contact Dr. Thornton. He must recognize what we're accomplishing." As Eleanor commenced the complex restoration, operating with velocity that seemed impossible for somebody who'd supposedly never operated at St. Michael's previously, communication dispersed through the medical facility. The provisional physician in operating room 3 had identified a life-endangering difficulty and was executing an operation well beyond the original surgical schedule. Medical residents assembled in the observation platform, attendants whispered in passageways, and Dr. Richard Thornton, receiving the contact while examining documents in his chamber, sensed his blood pressure ascending. In operating room 3, Eleanor operated with concentrated intensity. Aortic fasteners. Circulation diversion initiated. "I must substitute this portion before the separation extends." "Park, can you expose the curved section?" Park navigated into location, operating alongside her. "Your approach is outstanding. This isn't community medical facility healthcare. This is specialized instruction. Where did you genuinely master this?" Elena's palms preceded their accurate labor. Locations where you either mastered rapidly or observed people perish. Locations where machinery was restricted, yet the requirement for perfection wasn't. Locations that instructed me to trust what my palms communicate to me more than what my vision perceives. As she operated, the surgical squad observed in expanding astonishment. The provisional physician who'd entered that morning as an unfamiliar temporary substitute was executing heart operation that most of them had merely studied about in publications. And outside operating room 3, Dr. Thornton was donning his medical scrubs, readying to witness precisely what Dr. Elena Vasquez was capable of. What he witnessed would dispute everything he believed he recognized about healthcare, guidelines, and the merit of background earned distant from distinguished healthcare facilities. Dr. Thornton entered the observation platform above operating room 3, his countenance a covering of regulated anger. Through the transparent barrier, he could perceive Eleanor operating with concentrated intensity, her palms navigating through the surgical area with accuracy that prompted him to hesitate despite his frustration. Beside him, 3 medical residents positioned observing, their demeanors ranging from astonishment to disbelief. Dr. Amanda Chen was the initial to detect Thornton's entrance. "Dr. Thornton," she stated softly, her tone uncertain. Dr. Vasquez identified an aortic separation that wasn't apparent on the preoperative images. "I'm conscious," Thornton stated curtly. His vision never departed Elena's palms. She advanced a standard valve substitution without my permission. In operating room 3, Eleanor's tone transmitted through the intercom with tranquil authority. "Aortic fastener in location, heart protection administered, muscle protection accomplished. Dr. Park, I require you to withdraw the curved section gently. I'm going to remove this separated portion and ready for transplant connection." Dr. Park positioned the withdrawal tool with cautious accuracy. His initial doubt had transformed into something resembling respect as he observed Elena operate. "The material quality is inferior than the imaging indicated," he commented. "How did you recognize this was here?" "Configuration identification," Elena answered, her palms never hesitating. "The calcium deposit distribution, the surface density variations, the patient's elevated blood pressure background. In total, they indicated early separation. I've witnessed this manifestation previously." "Where?" Park inquired, genuinely inquisitive now rather than disputing. Locations where awaiting for flawless diagnostic verification meant observing patients perish on the platform, Eleanor positioned the blood vessel transplant. Thread 40 synthetic. The surgical attendant transferred her the thread with firm palms, yet her vision was expanded. She'd assisted hundreds of heart operations, yet Eleanor's approach was unlike anything she'd witnessed. Each thread was positioned with mathematical accuracy, the interval precise, the tension flawless. There was no uncertainty, no additional contemplation, merely fluid performance that communicated of extensive background. In the observation platform, Dr. Chen leaned toward Thornton. Her approach is remarkable. Those are field operation threads, aren't they? The interrupted configuration designed for maximum strength with minimal material. Thornton's muscles contracted. Where did you master identifying that? My relative served as a naval medical technician. He revealed me photographs of surgical approaches utilized in forward operating stations. Dr. Vasquez's threading configuration corresponds precisely. Down in operating room 3, Eleanor finalized the initial connection. Nearest transplant attachment finalized, reviewing for drips. Dr. Patel, how are our patient's vital signs? The sedation specialist consulted her displays. Remarkably steady. Temperature 32 degrees Celsius. Heart arrested. Circulation diversion flows optimal. He's tolerating the operation admirably. Excellent. Eleanor navigated to the distant connection. This is the critical junction. If this collapses, we lose him. Her tone remained firm, clinical, betraying no sentiment despite the existence or death stakes. Dr. Park observed her palms create the blood vessel junction with flawless approach. I've been accomplishing heart operation for 12 years, he stated softly. I've never witnessed anybody operate this rapidly with this degree of accuracy. Not even Dr. Thornton. Velocity originates from requirement, Elena answered. When you function in surroundings where you don't possess luxury of duration, you master proficiency. Every moment counts when materials are restricted. What category of surroundings are we discussing? Park challenged. Material-restricted environments, conflict territories, locations where Physicians Without Borders dispatches physicians when traditional healthcare infrastructure has deteriorated. Elena finalized another thread. There. Distant connection finalized. Prepared to release fasteners and review circulation. In the platform, Thornton's demeanor had transformed from frustration to something more intricate. He was observing a surgical execution that equaled his own finest labor, performed by a physician he'd rejected as a provisional substitute merely hours earlier. You stated she challenged the rear aortic surface in this morning's overview. He stated to the residents. Affirmative, sir, Amanda verified. You communicated her the imaging had been examined by 3 supervising physicians. I accomplished. Thornton's tone was softer now. And she was accurate. We all overlooked it. Down in operating room 3, Eleanor was removing the aortic fastener. Fastener removed, resuming heart function. She observed the heart cautiously as it commenced to contract again. Excellent circulation through the transplant. No drips apparent. Dr. Park, can you perceive any regions of trouble? Park scrutinized the surgical area comprehensively. Everything appears flawless. The transplant is positioned admirably. The connections are drip-free and the valve is operating appropriately. Eleanor permitted herself a small instance of contentment. Patient departing from circulation diversion. Dr. Patel, what do you perceive? Vital signs strengthening, Patel reported, amazement evident in her tone. Blood pressure ascending to normal parameters. Pulse pattern regular. This is remarkable restoration. Let's shut the heart covering and commence chest closure, Elena stated, already navigating to the subsequent phase. She operated with the same systematic proficiency she'd demonstrated throughout. Each layer shut with flawless approach. The surgical attendant assisting her whispered to her associate, I've been in chest operation for 8 years. I've never witnessed a complex restoration finalized this smoothly. Her associate acknowledged, and regard the duration. We've been in here 3 hours and 12 minutes. A restoration like this normally requires 5 to 6 hours. In the observation platform, Thornton reviewed his timepiece and sensed something he rarely encountered: genuine amazement. 3 hours, 12 minutes from initial incision to closure arrangement, he stated aloud, for a valve substitution that became in crisis aortic restoration. That shouldn't be achievable. Yet, it's occurring, Amanda Chen stated softly. Dr. Thornton, who is she genuinely? Before Thornton could respond, his device vibrated. A communication from the medical facility's organizational supervisor. Richard must review Dr. Vasquez's qualifications. Her professional history reveals interruptions. Doctors Without Borders verified 7 years in field functions. Syria, Yemen, Democratic Republic of Congo. Over 300 heart operations in conflict territories. Why didn't you examine her complete background? Thornton gazed at the communication, then returned through the transparent barrier at Elena, who was now supervising the concluding closure. 300 heart operations in combat territories. That clarified the proficiency, the assurance, the capability to operate under pressure that would immobilize most civilian physicians. In Operating Room 3, Eleanor removed her surgical coverings as Dr. Park supervised the concluding stages. Patient is steady and prepared for transfer to heart-intensive care, she declared. Anticipated restoration is outstanding, excluding unforeseen difficulties. Dr. Vasquez, Park stated, consideration evident in his tone. That was outstanding operation. You rescued this man's existence by identifying what the remainder of us overlooked. I accomplished what any competent physician should accomplish, Elena answered, already navigating toward the preparation chamber. Watch, evaluate, and respond appropriately. That's not standard competence. That's outstanding ability, refined by extensive background, Park pursued her. Background you haven't been completely forthcoming about. Eleanor hesitated at the preparation chamber entrance. My professional history contains all pertinent qualifications for this role, Dr. Park. What it doesn't contain is protected by different confidentiality contracts with humanitarian organizations. You operated in conflict territories. I operated in locations where people required physicians and weren't specific about where those physicians had instructed or what their achievement percentages were in distinguished healthcare facilities. Elena's tone transmitted an edge now. Locations where guideline mattered less than maintaining people breathing with whatever materials you possessed accessible. Before Park could respond, the preparation chamber entrance accessed, and Dr. Thornton entered. Dr. Vasquez, he stated, his tone cautiously regulated, we must review what merely occurred in that operating room. Eleanor encountered his stare firmly. We successfully finalized an aortic valve substitution with rising aortic restoration. The patient is steady and anticipated to create complete restoration. What particular aspect would you desire to review? The aspect where you advanced a standard operation to complex heart operation without my direct permission, Thornton stated. The aspect where you demonstrated surgical abilities that surpass what your professional history indicated. The aspect where you apparently possess 7 years of field surgical background that you neglected to reference during your consultation. My field background was recorded in my submission, Elena answered tranquilly. If it wasn't examined comprehensively, that's not a collapse on my portion. The chamber descended silent. Through the transparent barrier, they could perceive the operating room squad readying the patient for transfer, the display revealing strong, firm heart patterns. The confirmation of Elena's surgical excellence was undeniable. Thornton absorbed a breath, and when he communicated again, his tone had lost some of its edge. You were accurate about the separation. You rescued that patient's existence. Your surgical approach is outstanding. Yet this medical facility functions on guidelines and power structure for excellent reasons. Guidelines are significant, Elena concurred, yet they're instructions, not absolute regulations. When guideline disputes with patient survival, I select survival every occasion. That's what my background instructed me. Background earned where? Thornton challenged. Syria, Yemen, Democratic Republic of Congo, South Sudan. locations where medical facilities functioned in canvas structures and could be obliterated by explosives at any instant. Eleanor's tone remained firm. Locations that instructed me to trust my evaluation and respond decisively because uncertainty meant death. Thornton examined her for a prolonged instant. Then, we must review your function here, Dr. Vasquez, because you're evidently not merely another provisional physician handling standard situations. What am I then? That, Thornton stated gradually, is what we're going to determine. The overhead communication system crackled to existence at 2:47 in the morning, obliterating the relative tranquility of St. Michael's Heart Surgical Division. All chest physicians to crisis department instantly. Mass casualty guideline, multiple critical heart injuries, all accessible operating room squad standby. Eleanor was in the emergency call chamber, examining patient records on her tablet. She'd been at the medical facility for 14 hours, yet sleep had confirmed elusive. Previous reflexes from fieldwork, you never genuinely slept when you were accountable for existences. She was navigating toward the crisis department before the declaration concluded, her military-grade timepiece already recording the duration, her consciousness transforming into sorting mode. The crisis room was regulated disorder. Emergency medical technicians wheeled stretchers through automated entrances, while attendants shouted vital indicators, and trauma squads assembled at designated locations. Eleanor absorbed the scene with rehearsed proficiency, her vision cataloguing injuries, evaluating material distribution, prioritizing interventions. Dr. Park manifested at her flank, donning a trauma covering. Transportation accident, he stated curtly, returning from regional basketball competition. 12 injured, 4 with critical heart or chest trauma. 2 more approaching by helicopter. Eleanor navigated toward the initial trauma station, her palms already evaluating the patient before anybody granted her authorization. 16-year-old male, the emergency medical technician reported. Recognized heart condition, enlarged heart muscle, was on transplant registry, now possesses severe chest trauma from collision. Vital signs are deteriorating. The young man's countenance was pale, his breathing strained. Eleanor's instructed vision absorbed the neck vein distension, the subdued pulse sounds, the contradictory heartbeat, heart muscle injury, potentially inferior. She regarded the display. Heart pumping efficiency was already jeopardized from his underlying condition, and now this trauma had pushed him into acute deterioration. Dr. Thornton strode into the crisis room, his attendants commanding instant focus. Status account, he requested. 4 critical heart situations, Dr. Park stated. 2 collapsed lungs requiring instant chest drainage placement, 1 suspected heart compression, and this patient. He motioned to the 16-year-old. Marcus Webb, enlarged heart muscle condition, pumping efficiency around 20% baseline, now with blunt heart trauma. Thornton navigated to Marcus's bedside, his experienced palms executing rapid evaluation. He examined the portable ultrasound scans that the crisis room had already secured, his demeanor becoming increasingly grave. Pumping efficiency is down to 15%. Severe injury to the frontal surface. Valve leakage has deteriorated substantially. His heart was scarcely operating before the accident. Now, he trailed off, yet everybody in the trauma station comprehended what he wasn't stating. Marcus was perishing. Dr. Thornton, what's the strategy? Park inquired. Thornton was silent for a prolonged instant, examining the displays, the ultrasound scans, the young man's deteriorating circumstances. Eventually, he communicated, and his tone transmitted the burden of impossible determinations. It's finished. There's nothing we can accomplish. He requires an instant transplant, and there are no organs accessible. Even if there were, he wouldn't survive the operation in this circumstances. Yet, there must be something, Dr. Park protested. He's 16 years aged. Sometimes being an excellent doctor means identifying when we've reached the boundaries of what healthcare can accomplish. Thornton's tone was determined, yet not unkind. We'll create him comfortable. inform his relatives, engage end-of-life care involved. Eleanor had been positioned at the periphery, yet now she navigated nearer. Her vision never departed Marcus's display, observing the heart pattern, the blood pressure, the oxygen level, all trending downward. She'd witnessed this configuration previously, in locations where surrendering wasn't an alternative, because there were no alternatives awaiting. An emergency medical technician entered the trauma station, the same one who transported Marcus in. Cole Jenkins, his identification tag stated. He regarded Eleanor and his demeanor altered, identification dawning. "Wait," he stated, "are you Dr. Vasquez?" "Eleanor Vasquez?" Eleanor looked at him briefly. "Do I recognize you?" "Aleppo, 2019. Cole's tone was confident now. "You functioned on my commanding officer after the medical facility got struck. You created a mechanical assistance system, utilizing field machinery when his heart was collapsing. You maintained him breathing for 3 days until we could transfer him to an appropriate facility." The trauma station had become silent, everybody's focus transforming between Cole and Elena. Thornton's demeanor was doubtful. "That's quite a narrative." "It's not a narrative," Cole insisted. "I observed her operate. She rescued 8 existences that night, with machinery that scarcely operated." He regarded directly at Elena. "Ma'am, if anybody can assist this young man, it's you." Marcus's mother burst through the crisis room entrances at that instant, an attendant attempting to maintain pace with her. "Where's my boy? Where's Marcus?" Patricia Webb's countenance was a covering of terror, the category Eleanor had witnessed excessively many occasions on parents in impossible circumstances. "Mrs. Webb," Thornton commenced, his tone adopting the cautious manner doctors utilized when delivering devastating information. "Your boy's injuries are extensive, his pre-existing heart circumstances combined with the trauma from the accident." "Is he going to perish?" Patricia requested. The phrases emerged raw, desperate. Thornton hesitated for merely an instant. "Mrs. Webb, we've evaluated Marcus's circumstances. His heart operation is critically impaired. Without an instant transplant, which we don't possess accessible, I'm afraid it's finished. I'm genuinely apologetic." Patricia's knees buckled. An attendant caught her, yet her vision never departed her boy's countenance apparent through the trauma station transparent barrier. "No," she whispered. "Please, he's all I possess. There must be something, anything." The silence in the crisis room was profound. Even the ambient sounds of the medical facility seemed to disappear. Eleanor positioned motionless, her vision navigating between Marcus's displays, the ultrasound scans, the accessible machinery. Her consciousness was calculating, evaluating, executing through scenarios she'd performed in circumstances where collapse meant death and achievement meant acquiring duration against impossible probabilities. She contemplated Aleppo, about the commanding officer Cole referenced, about the created mechanical assistance systems constructed from surgical machinery and battlefield ingenuity. She contemplated the children in Yemen who'd survived because she refused to acknowledge that some patients were beyond rescuing. She contemplated every teaching mastered in locations where guideline was a luxury nobody could afford. Thornton was already pivoting away, readying to grant orders for end-of-life care. The trauma squad was commencing to disperse, acknowledging the chief physician's declaration. "It's finished." Those phrases hung in the atmosphere like a concluding verdict. Eleanor absorbed a breath, created a determination, and advanced forward into the center of the trauma station. Her tone was soft, yet transmitted absolute confidence. "There's still a method." Every cranium in the crisis room pivoted to regard her. Thornton froze mid-step. Dr. Park's vision expanded. Patricia Webb regarded up with desperate optimism. "Dr. Vasquez, what are you discussing?" Thornton's tone was sharp. "The young man's heart is collapsing. He requires a transplant we don't possess." "He requires bridge assistance until a transplant becomes accessible," Elena corrected. "Standard circulation assistance won't operate with this degree of heart dysfunction. Standard heart assist devices won't accommodate his body structure in this acute phase. Yet, there's another alternative. What alternative? Park inquired, navigating nearer. Created dual heart assist device with non-conventional tube placement, Elena stated, her consciousness already scheduling the operation. I utilize a through-stomach approach combined with direct heart surface assistance. It's not academic manual healthcare. It's adapted field operation, yet I've accomplished it 9 times. 7 patients survived. That's not an identified operation, Thornton stated, his tone ascending. You're discussing experimental operation with no approved guideline. I'm discussing the sole alternative that grants Marcus an opportunity to survive prolonged enough to secure a transplant. Eleanor encountered Thornton's vision directly. In 2 weeks, perhaps less, a compatible heart will become accessible, yet solely if Marcus is breathing to receive it. This is insane, Thornton stated. You desire me to HB authorize an unapproved experimental operation on a minor in critical circumstances. I desire you to select between confident death or potential survival. Elena's tone remained firm. Sir, I comprehend guidelines. I comprehend responsibility. I comprehend that what I'm proposing sounds impossible, yet I've operated in locations where impossible was merely another day's dispute. And I'm communicating you this can operate. Where? Thornton requested. Where did you master this approach? Reveal me literature. Reveal me research. Reveal me something beyond your phrase. There is no literature, Eleanor stated plainly. There are 7 patients in 3 different nations who are breathing today because I adapted heart assistance machinery to operate in circumstances where traditional approaches collapsed. That's my confirmation. Patricia Webb pushed forward, her tone breaking. Dr. Thornton, please. If she states there's a method, permit her to attempt. He's my boy. He's 16 years aged. He possesses his complete existence ahead of him. Mrs. Webb, Thornton commenced, yet Eleanor interrupted. Marcus possesses approximately 4 hours before heart operation declines to the point of irreversible organ damage. Eleanor's tone was clinical now, presenting facts rather than appeals. If we advance, we require operating room duration, circulation squad, and complete heart surgical assistance. Dr. Park as initial assist, and we require to navigate now. The crisis room descended silent again. Every vision was on Thornton, awaiting for the determination that would decide whether Marcus Webb lived or perished. The chief physician regarded Eleanor, at the perishing young man, at the desperate mother. His countenance revealed the struggle of a man whose complete profession had been constructed on guideline, confronting a circumstance where guideline proposed no solutions. Dr. Thornton positioned motionless for what sensed like perpetuity, yet was solely 15 moments. His vision navigated from Elena to Marcus, whose displays revealed declining heart operation with each passing instant. The determination he created in the subsequent few moments would decide whether a 16-year-old young man lived or perished. Dr. Vasquez, he stated eventually, his tone cautiously regulated. What precisely are you proposing? Created dual heart mechanical assistance, Elena answered instantly. I'll insert tubes in the left heart chamber through a modified apex approach and the right heart chamber through the lung outflow passage. External circulation system provides complete heart assistance while his heart rests and we await for transplant distribution. That's not standard assist device placement, Dr. Park interjected, though his manner was more inquisitive than disapproving. You're discussing non-approved tube locations. Standard assist device won't operate in acute trauma with this body structure, Elena clarified. His heart chambers are excessively enlarged and damaged. Traditional inflow tubes would produce more harm. Yet, direct apex tube insertion with heart surface assistance distribution? I've witnessed it operate when nothing else would. Witnessed it where? Thornton requested. Reveal me 1 published situation research, 1 peer-reviewed article, 1 fragment of confirmation beyond your phrase. Elena encountered his stare without wavering. There are no published researchers. There are 7 living patients across 3 continents who survived because I adapted machinery to circumstances. That's my confirmation, Dr. Thornton. People who are breathing today because Guideline accepted a secondary position to survival. The crisis room surrounding them preceded its regulated disorder. Other trauma patients were being steadied, chest drainage positioned, crisis operations initiated, yet every person in Marcus's trauma station was concentrated on this discussion, this impossible determination, this instant that would define what category of medical facility St. Michael's genuinely was. Mrs. Webb navigated nearer, her tone breaking yet determined. I don't concern myself with published researches. I concern myself with my boy. Dr. Thornton, if she states there's an opportunity, please permit her to attempt. Marcus's display alarmed, blood pressure declining to 80/40, pulse ascending to 130. The young man was executing out of duration. Eleanor's tone remained firm. We possess perhaps 90 minutes before heart operation deteriorates beyond restoration. If we're going to accomplish this, we require operating room 1, complete circulation squad, and every piece of heart assistance machinery this medical facility possesses. Dr. Park, I'll require you as initial assist. You'll require to trust my judgment on tube placement, even when it appears incorrect. Park regarded Thornton, awaiting for the chief's determination. Sir? Thornton shut his vision briefly. Eleanor could perceive the combat executing out behind his demeanour. 15 years of guideline-focused achievement versus 1 instant of desperate innovation. Profession concluding responsibility versus a teenager's existence. The burden of impossible selections. When he accessed his vision, something had transformed. Dr. Vasquez, if this operation collapses, if Marcus Webb perishes on that platform, both our professions are concluded. The medical facility will confront legal actions. The committee will request answers. Everything I've constructed here could deteriorate. Affirmative, sir, Elena stated plainly. That's all accurate, and if it achieves, then a 16-year-old young man receives to exist prolonged enough to receive a heart transplant. Eleanor's tone transmitted absolute conviction. And perhaps we confirm that innovation matters as much as guideline. That background earned in difficult locations possesses merit even in elite healthcare facilities. The silence stretched. Marcus's alarm sounded again, 75/38. Duration was executing out. Dr. Park, Thornton stated eventually, ready operating room 1 for crisis heart operation. Secure the circulation squad assembled. Eleanor sensed something release in her chest, yet Thornton wasn't concluded. Dr. Vasquez, I'm authorizing this operation under crisis experimental guidelines. Mrs. Webb will require to sign consent, acknowledging the hazards. You will possess complete surgical autonomy, yet I will be watching. If at any point I decide the patient's existence is in greater danger from the operation than from the underlying circumstances, I reserve the authority to cease the function. Acknowledged, Elena stated. And Dr. Vasquez, Thornton's tone transmitted an edge now, you better be accurate about this, because if you're not, I'll create confident you never practice healthcare again. If I'm incorrect, Elena answered softly, I won't desire to practice healthcare again. Patricia Webb was already signing consent documents, her palms shaking, yet determined. The crisis room attendant personnel commenced mobilizing Marcus for transport to operating room 1. Dr. Park was on the device coordinating the surgical squad. Cole, the emergency medical technician, positioned observing with a demeanour that mixed consideration and identification. Dr. Vasquez, Cole stated as the squad ready to navigate. In Aleppo, you communicated us that field healthcare wasn't about possessing flawless circumstances. It was about creating impossible determinations with whatever you possessed accessible. I remember, Elena stated, reviewing Marcus's intravenous lines. This young man, he's receiving the same opportunity you granted my commanding officer. Cole's tone was determined. Don't permit these people create you doubt. What you recognize operates. Elena acknowledged once, then pursued the stretcher toward the elevators. Dr. Park descended into stride beside her. You comprehend this could obliterate both our professions. I comprehend that Marcus Webb deserves an opportunity to graduate secondary academy, Elena answered. Everything else is secondary. They entered the elevator. Through the closing entrances, Eleanor could perceive Thornton on his device, likely alerting the medical facility committee to what was about to occur. Patricia Webb positioned with an attendant, her countenance a mixture of optimism and terror. The crisis room preceded its organized disorder, yet for one instant, everything seemed to hesitate. In the operating room, Eleanor positioned at the preparation basin, systematically readying. This was recognizable territory. She'd accomplished this hundreds of occasions, in locations where the basin was a container and the cleaning agent was whatever you could discover, where the operating room was a canvas structure and explosive fire provided the background sounds, where every operation was experimental because academic manual healthcare didn't account for conflict territories and collapsing infrastructure. Dr. Park prepared beside her. Communicate me honestly, he stated softly. Those 7 survivors you referenced. What occurred to the 2 who didn't create it? One had sustained excessive organ damage before I could intervene, Elena answered, her tone clinical, yet transmitting an edge of previous pain. Commenced the operation 4 hours excessively late. The other, we lost electrical power mid-operation. Generator collapsed and we had to conclude by manual circulation. He survived the operation, yet perished 3 days later from difficulties. Park absorbed this. And you're assured Marcus isn't excessively distant gone? His organ operation is still adequate. We possess electrical power that won't collapse. And we possess duration, scarcely, to perform appropriately, Eleanor concluded, preparing. Affirmative, I'm assured. Not confident, yet assured. What's the distinction? Confidence is what you possess when you're operating with confirmed guidelines in ideal circumstances, Elena stated. Assurance is what you possess when you've confronted this circumstance previously and recognize what achievement requires. I can't promise Marcus will survive, yet I can promise I'll accomplish everything humanly achievable to grant him that opportunity. They entered Operating Room 1, where the surgical squad was finalizing last arrangements. The circulation machinery positioned, prepared, machines that would assume the operation of Marcus's collapsing heart. The sedation specialist, Dr. Patel, glanced up from her arrangements. Patient is prepared for initiation. Vital signs are precarious, yet steady enough for now. Eleanor positioned herself at the platform. She absorbed a breath, permitted her consciousness transform completely into the mode that had maintained her operating in impossible circumstances. Guideline dissolved. Power structure disappeared. There was solely the patient, the problem, and the solution her palms would create. Duration to initial incision, she declared. We possess one opportunity to secure this accurate. Her vision encountered each member of the surgical squad. I require everybody's complete concentration and trust. What I'm about to accomplish will appear unconventional. You might believe I'm creating mistakes. You might desire to communicate up, yet I require you to trust that I recognize what I'm accomplishing. The squad acknowledged. Above, in the observation platform, Dr. Thornton settled into his position, his demeanor unreadable. Beside him, medical residents and supervising doctors assembled to witness what might be groundbreaking operation or catastrophic collapse. Elena regarded down at Marcus Webb, 16 years aged, basketball athlete, boy, patient, somebody's complete world, resting unconscious and perishing on her platform. She selected up the cutting instrument. Let's rescue an existence, she stated. The cutting instrument contacted Marcus Webb's chest at 3:14 in the morning. Eleanor's incision was assured, intentional, pursuing the path her consciousness had mapped during the arrangement. Central chest incision. The blade navigated through skin, underlying material, exposing the breastbone beneath. Chest sore, she stated tranquilly. The tool was positioned in her palm. In the observation platform, Dr. Thornton leaned forward, his experienced vision tracking every navigation. Beside him, medical residents observed with mixture of fascination and dread, recognizing they were witnessing either revolutionary healthcare or profession concluding catastrophe. Saw through, Eleanor declared. Separator placement. The chest separator accessed Marcus's chest, exposing the heart covering that contained his collapsing heart. Dr. Park positioned himself across from Elena, prepared to assist, yet uncertain what he was about to witness. Heart covering appears tense, Park commented. Potential fluid accumulation from the trauma. Verified, Elena stated, her gloved palm gently palpating the material. I'm accessing now. She created a cautious incision in the heart-covering sac, and instantly bloody fluid welled up. Blood accumulation, as anticipated. Drainage. The surgical attendant provided drainage, clearing the area. As the blood drained away, Marcus's heart entered visibility, and the complete surgical squad drew breath. The organ was enlarged, beating weakly, the frontal surface revealing apparent injury from the accident's collision. Jesus, Park whispered. The muscle damage is extensive. Frontal surface injury approximately 8 centimeters in diameter, Eleanor narrated, her tone clinical despite the severity. Heart chamber operation is minimal. Both chambers are enlarged beyond normal parameters. This heart cannot sustain existence without mechanical assistance. In the platform, one medical resident pivoted to another. She's going to insert tubes in that. It appears like it'll rupture if she contacts it incorrectly. Dr. Thornton stated nothing, yet his palms gripped the observation rail tightly. In the operating room, Eleanor proceeded her evaluation. Dr. Patel, current blood flow dynamics? The sedation specialist consulted her array of displays. Blood pressure 70/40 and declining. Pulse 140, oxygen level 86%, despite maximum assistance. He's deteriorating. Duration to tube insertion, Eleanor declared. Dr. Park, I require you to gently elevate the apex of the left heart chamber. Don't compress, merely sustain. Park's palms navigated cautiously, pursuing her instructions. His extensive surgical background communicated him. This approach was unconventional, yet Eleanor's assurance was absolute. The apex entered visibility, the damaged muscle apparent even through the heart surface. This is the critical instant, Elena stated, her tone firm yet transmitting fresh intensity. Traditional assist device placement would utilize the lateral surface, yet with this degree of injury, that approach would produce rupture. I'm proceeding directly through the apex, which will permit me to position the tube inflow in the center of the heart chamber without disrupting the damaged material. That's not a proved approach, Park stated, though his manner was observational rather than disapproving. A proved approach doesn't account for this particular injury configuration, Elena answered. Apex tube insertion, with reinforced thread rings. I require the 14mm tube with felt padding readied. The circulation squad navigated rapidly, assembling the tube insertion machinery. This was specialized hardware characteristically utilized in different configurations, yet Eleanor was adapting it for her created approach. Padding threads positioned, she proceeded, operating with accuracy that seemed impossible, considering the fragile, damaged material she was manipulating. Each stitch was precise, reinforcing the material without tearing through it. This is field operation approach adapted for heart application. Multiple interrupted threads, distributing tension across maximum surface region. The medical residents in the platform were leaning so distant forward, they were nearly pressing against the transparent barrier. One extracted his device, recording the operation despite medical facility policy. This would be reviewed in surgical conferences for years, one method or another. Tube prepared for insertion, Elena declared. On my indication, advancing now. The tube slid through the reinforced entry point into Marcus's left heart chamber. For a heartbeat, nothing occurred. Then Dr. Patel's tone transmitted through the operating room. Blood, pressure, maintaining. No instant deterioration. Tube in location, Elena verified. Securing now. Her palms operated rapidly, finalizing the fixation threads that would maintain the tube steady. Left heart chamber, inflow established. Now for the right heart chamber. Dr. Park was observing with expanding comprehension. You're creating complete dual-chamber circulation diversion. The heart won't be circulating at all. The machines will accomplish everything. Accurate, Elena stated. His heart muscle requires complete rest to restore from the trauma. Partial assistance won't be sufficient. Park, I require you to expose the right heart chamber outflow passage. As Park repositioned, one of the surgical attendants whispered to her associate, I've been in heart operation 12 years, never witnessed anything like this. The right heart chamber tube insertion was even more technically demanding. The lung outflow passage was smaller, the material more delicate, and the margin for error essentially zero. Eleanor operated with concentrated intensity, her movements efficient yet accurate. Right heart chamber tube advancing, she narrated. Location verified by palpation. The tube slid into location, and she commenced the securing threads with the same reinforced approach she'd utilized on the left heart chamber. Both tubes positioned, she declared, readying outflow tube insertion to main artery and lung artery. This will create complete heart circulation diversion with independent regulation of body and lung circulation. Dr. Thornton's device vibrated. A text communication from the Medical Facility Committee Chairman. Richard, what precisely is occurring in that operating room? Multiple committee members are receiving communications from night personnel about experimental operation on a minor. Thornton silenced his device without responding. His vision never departed the surgical area. Eleanor was connecting the outflow tubes now, creating the pathways that would redirect oxygenated blood to Marcus's body while his heart rested. The technical complexity was outstanding, each junction requiring flawless placement and absolutely drip-free seals. Main artery outflow connected, she reported. Lung artery outflow connected. Dr. Park, initiate circulation flows. Commence at 2 litres per minute and increase gradually. The circulation squad activated the circulations. In Marcus's chest, his heart preceded its weak contractions, yet now external machines were assuming the labour of circulation. The displays commenced to alter, gradually yet measurably. Body pressure ascending, Dr. Patel reported, amazement in her tone. 70/45, 80/50, 90/55. Increase flows to 4 litres, Eleanor directed. Observe for any indicators of heart chamber distension. The circulations increased their output. Marcus's heart, no longer bearing the burden of circulation, commenced to decompress. The distended chambers became slightly smaller as the mechanical assistance assumed completely. This is remarkable, Park stated softly. His heart output is being sustained completely by external circulations. I've studied about this theoretically, yet never witnessed it performed. 4.5 litres per minute accomplished, the circulation specialist declared. Flows are steady. Pressures are optimal. Dr. Patel's tone transmitted fresh energy. Blood pressure 100/60. Pulse declining to 90. Oxygen level 94% and ascending. Organ circulation is improving dramatically. In the platform, the medical residents erupted in whispered excitement. Dr. Thornton remained silent, yet something in his demeanour had transformed. He was observing not a provisional physician creating desperately, yet a master technician performing an operation most physicians couldn't imagine, let alone execute. Then, Marcus's display alarmed, high-pitched, urgent, cutting through the operating room's regulated tension. Heart chamber fibrillation, Dr. Patel announced. He's lost coordinated heart pattern. The surgical squad tensed. Eleanor's tone remained absolutely firm. Anticipated difficulty from the trauma and manipulation. Internal paddles prepared, 20 energy units. The internal defibrillator paddles were positioned directly on Marcus's heart. Clear, Eleanor stated. Everybody stepped back. Shock delivered. The heart muscle convulsed, then descended back into fibrillation. No pattern alteration. 30 energy units, Elena stated, repositioning the paddles fractionally. Clear. Another shock, another collapse to convert. In the platform, one medical resident grabbed another's arm. This is it. This is where it collapses apart. Dr. Thornton positioned motionless, his vast background communicating him. They were moments from losing the patient. One more collapsed attempt, and Marcus's heart would be irretrievably damaged. Eleanor's tone cut through the tension. Cardiac medication, 100 milligrams intravenous, direct heart injection. Ready for 50 energy units internal defibrillation. That's maximum voltage, Park stated. At that degree, you could damage the heart muscle beyond restoration. At this degree, Eleanor answered tranquilly, we either convert the pattern or we lose him. There's no middle territory. She absorbed the syringe of cardiac medication and injected directly into Marcus's heart muscle. Count of 3. 1, 2, 3. Clear. 50 energy units discharged directly into Marcus's heart. The display revealed a flat line. 1 moment, 2 moments, 3 moments of absolute silence in operating room 1. Every vision fixed on the heart display. Every breath maintained. Then a signal. Another. Another. Normal heart pattern established, Dr. Patel declared, her tone shaking slightly. Pulse? 70. Regular pattern, he steadied. The operating room released its collective breath. Eleanor's palms navigated instantly to evaluate the heart, reviewing for damage from the defibrillation. Heart muscle appears intact. No apparent burns or rupture from electrical discharge. She regarded up at Dr. Park. That's the instant where field background matters most, recognizing precisely how much you can challenge before producing irreversible harm. Park acknowledged gradually. Where did you master interpreting that boundary so accurately? Locations where you solely secured one opportunity, Elena answered. Locations where if you estimated incorrectly, you existed with the consequences. She commenced her concluding reviews of the tube locations, the circulation junctions, the surgical area. Everything is secure. Flows are steady. He's completely sustained by mechanical circulation. She stepped back from the platform. Now, we await for a transplant. In the observation platform, Dr. Thornton eventually released his grip on the rail. His palms were shaking slightly. He'd practiced operation for 3 decades, instructed hundreds of medical residents, executed thousands of operations, and he'd merely observed something he'd never imagined achievable. One medical resident pivoted to another, his tone awed. Did that merely actually operate? Below, Eleanor was commencing to shut Marcus's chest, her approach as flawless as everything that had preceded. The impossible had become reality. A 16-year-old young man who'd been declared unrescuable was now breathing, his heart resting while machines sustained his existence, awaiting for a donor organ that might permit him to actually survive. Patient, steady, Eleanor declared to the operating room. Anticipated duration to transplant accessibility is approximately 2 weeks based on current registry location and his increased priority status. She looked at the surgical clock. Total operation duration, 4 hours, 18 minutes. Dr. Park communicated the contemplation everybody was considering. I've been a heart physician for 12 years. That was the most outstanding operation I've ever witnessed. Eleanor removed her surgical coverings, her demeanour unchanged. It was what required to be accomplished. That's all. Yet everybody in that operating room recognised they'd merely witnessed something distant, more substantial than an achievement operation. They'd perceived the impossible become achievable through ability, background, and absolute refusal to acknowledge defeat. Now the inquiry became whether Marcus Webb would survive, prolonged enough for that miracle to matter. 5 days after Marcus Webb's operation, Dr. Elena Vasquez positioned outside the heart intensive care, observing through the observation transparent barrier. The 16-year-old rested in bed, chest sutured shut, mechanical circulations humming softly as they sustained his circulation. His mother sat beside him, maintaining his palm, reading to him from a basketball publication, though he remained sedated. Eleanor hadn't departed the medical facility for more than a few hours at a duration since the operation. Previous reflexes, when you were accountable for maintaining somebody breathing with created machinery, you remained close. You observed for difficulties. You anticipated problems before they became catastrophes. Dr. Vasquez, Dr. Thornton's tone originated from behind her. His manner was different now, less authoritative, more contemplative. The committee is assembling in meeting chamber 3. They'd desire to communicate with you. Elena pivoted to confront him. Am I being dismissed? Thornton's demeanour was unreadable. That relies on the discussion we're about to possess. They walked in silence through the medical facility passageways. Personnel members observed them pass, whispers pursuing in their wake. The provisional physician who challenged the chief. The experimental operation that had shocked the healthcare community. Marcus Webb's survival had become legend in 5 days, dispersing through healthcare networks quicker than any publication release. The meeting chamber maintained 7 committee members, all observing Elena enter, with demeanours ranging from curiosity to trouble. Patricia Chen, the committee chairwoman, motioned to an unoccupied position. Dr. Vasquez, appreciate for accompanying us. Please sit. Elena remained positioned. With consideration, I prefer to receive adverse information, while positioned. Several committee members exchanged looks. Who stated this was adverse information? Chen inquired. Background, Elena maintained her tone impartial. When medical facility committees request assemblies 5 days after unauthorized experimental operations, it's rarely to propose congratulations. Chen's demeanour softened slightly. Dr. Vasquez, Marcus Webb is breathing because of your intervention. His transplant placement has been elevated to status 1, and preliminary donor coordination reveals a potential heart within the upcoming 10 days. You accomplished something our chief of operations stated was impossible. So, why? Does this sense like a termination assembly? Elena inquired directly. Because we require to comprehend who you are, Chen answered. Your professional history reveals remarkable qualifications, yet substantial interruptions. Healthcare degree from Hopkins, surgical residency at Massachusetts General, then 7 years with Physicians Without Borders, Syria, Yemen, Democratic Republic of Congo, South Sudan. Over 300 heart operations executed in conflict territories. She hesitated. Yet, what your professional history doesn't clarify is why you're operating provisional roles instead of acknowledging permanent functions at distinguished healthcare facilities. Eleanor was silent for an instant, because distinguished healthcare facilities require adherence to guidelines that don't account for circumstances where guideline collapses. Because I've witnessed excessively many organisational assemblies about responsibility when I should have been in operating rooms rescuing existences. You don't trust institutional healthcare, committee member David Reeves commented. I trust healthcare, Elena corrected. I don't trust bureaucracy that prioritises process over patient results. Dr. Thornton leaned forward. Dr. Vasquez, may I communicate candidly? Elena acknowledged. When you challenged me in that initial overview, I was insulted. Thornton's tone transmitted an edge of admission. When you advanced Robert Morrison's operation without permission, I was furious. And when you proposed that experimental operation for Marcus Webb, I believed you were reckless to the point of malpractice. Eleanor encountered his stare firmly. And now? Now I've spent 5 days examining your approach, researching field healthcare guidelines, and consulting with associates who've operated in conflict territories. Thornton's demeanour transformed. What you accomplished in that operating room wasn't recklessness. It was expertise earned under circumstances most physicians never confront. You've developed abilities that civilian healthcare desperately requires, yet doesn't recognise how to merit. Where is this proceeding? Elena inquired. Chen extracted a document. St. Michael's would desire to propose you a permanent role as supervisor of innovative heart operation. Complete autonomy, dedicated operating room duration, budget for research into field-adapted approaches. We desire you to develop a program instructing physicians in created heart assistance methods. Eleanor gazed at the document. You desire me to instruct other physicians approaches that aren't approved by any healthcare committee? We desire you to expand the definition of what's clinically achievable, Chen answered. Your methods operate. Marcus Webb is breathing because you refuse to acknowledge conventional boundaries. We require more physicians who contemplate that method. Yet there's a complication, Elena stated. There's always a complication. Reeves communicated up. We require to comprehend why you departed Physicians Without Borders. Your record reveals 7 years of outstanding labour, then abrupt departure. No clarification in your document. Eleanor's demeanour hardened. Some documents are sealed for reasons. We require to recognise those reasons before proposing permanent roles, Reeves insisted. No, you don't, Eleanor's tone transmitted finality. You require to recognise whether I can accomplish the responsibility you're proposing. My previous healthcare execution communicates for itself. Dr. Vasquez, Chen stated gently, we're not attempting to invade your privacy, yet this role requires trust, complete trust, and that requires comprehension. Comprehension what? That I departed because I was depleted? Because I created determinations that haunt me? Elena's composure cracked slightly. You desire to recognise why I operate provisional roles? Because permanent roles mean permanent accountability for circumstances that proceed incorrectly despite flawless approach. What proceeded incorrectly? Thornton inquired softly. Elena was silent for a prolonged instant. Then she commenced communicating, her tone distant. Yemen, 2021. Pediatric Heart Unit in Sana'a. We possess 3 children who required crisis operation. I possess supplies for perhaps 2 operations. I sorted, created the determination, functioned on the 2 with finest survival probability. She hesitated. The 3rd child perished awaiting. That's appropriate sorting guideline, Chen stated. You created the accurate healthcare determination. Communicate that to her mother. Eleanor's tone was tight. Communicate her that healthcare guideline required sacrificing her daughter so 2 other children could exist. Dr. Park, who'd been silent until now, entered the chamber with a folder. Apologetic, I'm late. He positioned the folder on the table. Elena, I tracked down healthcare records from that Sana'a mission. That 3rd child, the one you believe you collapsed. Elena's vision shut. I recognise what occurred. I was there. You weren't communicated everything, Park proceeded. That child possessed undiagnosed heart abnormality with severe valve leakage. Even with operation, her survival probability was less than 15%. The heart specialist on location verified it after you'd already created your sorting determination. You didn't select between 3 viable patients. You selected accurately between 2 you could rescue and 1 who was likely unrescuable regardless. Elena's vision accessed, confusion and pain mixing in her demeanour. Nobody communicated me that. Because the mission was chaotic and you departed 2 weeks later, Park stated gently. Yet the records are evident. Your sorting determination was clinically sound. Those 2 children you rescued. 1 is finalising university. The other became a doctor inspired by the physician who rescued her existence. Eleanor sat down eventually, the burden of 3 years of guilt pressing against fresh data. I believed I'd collapsed her. You created an impossible determination with the data accessible, Thornton stated. That's what field healthcare requires, and it's precisely why we require you here, instructing others how to manage circumstances where flawless data doesn't occur. Chen pushed the contract forward. Dr. Vasquez, we're proposing you an opportunity to multiply your impact. Every physician you instruct will transmit your approaches to their operating rooms. Every patient they rescue utilizing your methods will owe their existence to your willingness to introduce under pressure. Elena regarded the document. This isn't merely a responsibility proposal. This is inquiring me to cease executing. Perhaps, Chen concurred, or perhaps it's inquiring you to cease punishing yourself for determinations that weren't collapses. What are the circumstances? Eleanor inquired. 3 requirements, Thornton stated. First, you develop comprehensive instruction in field-adapted heart approaches. Second, you serve as consultant on complex situations where standard guidelines aren't sufficient. Third, you mentor physicians who've experienced comparable trauma, who transmit guilt for patients they couldn't rescue. You desire me to be therapist and physician? We desire you to be what you already are, Park stated. Somebody who comprehends that healthcare isn't merely about approach. It's about transmitting the burden of impossible selections and still manifesting to rescue the subsequent existence. Eleanor selected up the writing tool, then hesitated. If I acknowledge this, Marcus Webb can't be the sole achievement narrative. There will be collapses, patients who perish despite everything I attempt. Can this institution manage that? This institution has managed collapse previously, Chen stated. What we haven't managed admirably is innovation. You're proposing us an opportunity to be superior, to rescue patients we currently surrender on. That's worth the hazard. Eleanor signed the document. The writing tool sensed heavy, like she was signing away 3 years of protective distance. When do I commence? You already possess, Thornton answered. 3 medical residents have requested to operate with you. Dr. Park has volunteered to co-develop the instruction program. And Marcus Webb's situation has attracted curiosity from heart physicians across the nation who desire to master your approaches. 3 months previously, you communicated me I was merely a temporary handling standard situations, Elena stated to Thornton. 3 months previously, I was incorrect, Thornton admitted. Sometimes the most valuable teachings originate from admitting our boundaries and mastering from those who surpass them. Outside the meeting chamber, Patricia Webb awaited. When Eleanor emerged, the older woman positioned rapidly. Dr. Vasquez, the transplant coordinator, merely contacted. They discovered a heart. Marcus receives his transplant tomorrow. Eleanor sensed something release in her chest. Flawless coordination? Flawless coordination, Patricia verified. Her vision filled with tears. You granted him this opportunity. You refused to surrender when everybody else had. He's not through this yet, Elena cautioned. Transplant operation is complex, and restoration will be demanding, yet he's breathing to confront those demands. That's everything, Patricia stated. Later that evening, Eleanor positioned in Marcus's intensive care chamber. The mechanical circulations preceded their rhythmic labor, sustaining an existence that 5 days previously had been declared finished. Marcus stirred, his sedation lightened in arrangement for tomorrow's transplant. His vision accessed, confusion granting method to consciousness. Dr. Vasquez? Hey, Marcus, Eleanor stated gently. How are you sensing? Like I secured struck by a transportation vehicle. He managed a weak smile. Oh, wait. I accomplished secure struck by something. His demeanor pivoted serious. They communicated me I was perishing, that there was nothing they could accomplish. There was a method, Elena stated plainly, merely not a conventional one. Appreciate for discovering it. Marcus's tone was sincere. Mum stated, you fought for me when everybody else ceased fighting. I accomplished what any excellent physician should accomplish, Elena answered, refused to acknowledge impossible as concluding. Marcus's vision was shutting again, exhaustion claiming him. Tomorrow I secure a fresh heart. Tomorrow you secure a fresh opportunity, Elena corrected. Create it count. As she departed the intensive care, Dr. Park encountered her in the passageway. Prepared for tomorrow? The transplant squad desires you to assist. Eleanor acknowledged, let's finalize what we commenced. 3 months later as the outline specified, yet that's a narrative for the subsequent portion. 3 months after Marcus Webb's groundbreaking operation, Dr. Elena Vasquez positioned in the simulation laboratory, observing a group of heart physicians from across the nation practice the created dual heart assistance approach she'd developed. The chamber was filled with specialized instruction machinery, body structure models, and doctors eager to master methods that academic manuals had never instructed them. This is the critical tube insertion point, Elena clarified, demonstrating the apex approach on a high-fidelity heart model. Traditional assist device placement assumes steady body structure. Field-adapted approaches account for damaged material, jeopardized structures, circumstances where academic manual methods will collapse. Her palms navigated with the accuracy that had become her trademark. You're not merely mastering an operation. You're mastering to contemplate beyond guideline when guideline isn't sufficient. Dr. James Park positioned beside her, co-directing the program they'd constructed together. The key principle, he added, is identifying when standard approaches will produce more harm than excellent. Dr. Vasquez has executed over 300 heart operations in conflict territories. That background instructed her to interpret circumstances most civilian physicians never encounter. In the rear of the chamber, Dr. Thornton watched with a demeanor that had transformed from doubt to consideration over the previous months. Beside him, representatives from the World Health Organization absorbed records on the instruction methodology. This wasn't merely a medical facility program anymore. It was becoming a blueprint for global heart care innovation. During the interval, a young physician reached Elena nervously. "Dr. Vasquez, I'm Dr. Sarah Chen. I merely finalized my heart fellowship and I'm about to commence at a rural medical facility with restricted materials. Your approaches, they could rescue existences where I'm proceeding, yet I'm afraid of creating mistakes, afraid of attempting something unconventional and collapsing." Eleanor examined the younger physician, perceiving her own doubts reflected back. "Collapse is portion of healthcare," she stated softly. "I've lost patients despite flawless approach. The inquiry isn't whether you'll collapse, it's whether you'll permit fear of collapse prevent you from attempting to rescue somebody who possesses no other alternatives." "How do you exist with the losses?" Sarah inquired. "You transmit them," Elena answered. "You master from them. You utilize that knowledge to rescue the subsequent patient." She hesitated. 3 months previously, I was transmitting guilt from a sorting determination I created in Yemen. A child who perished while I rescued 2 others. I believed I'd collapsed her. What altered? I mastered that the burden I'd been transmitting was based on incomplete data. That child possessed circumstances that created survival unlikely regardless of my determination. Yet, more significantly, I mastered that the 2 children I accomplished rescue. One is finalizing university. One became a physician. Eleanor's tone strengthened. The point isn't perfection, it's maximizing who you can rescue with the abilities and materials accessible. That afternoon, Eleanor visited Marcus Webb in the outpatient heart restoration facility. The 16-year-old was on a treadmill, his transplanted heart operating flawlessly, his restoration surpassing all projections. His mother, Patricia, sat nearby, observing with the fierce protectiveness of somebody who'd nearly lost everything. "Dr. V," Marcus announced, slightly breathless yet grinning. "Review it out. 2 miles without ceasing. Coach states I might be capable to execute basketball again, subsequent year." Cautiously, Elena cautioned, yet her smile was genuine. "Your fresh heart is operating beautifully, yet you require to consider its boundaries." "Boundaries?" Marcus scoffed good-naturedly. "You instructed me that boundaries are merely disputes awaiting to be overcome. I instructed you that some boundaries occur for excellent reasons," Elena corrected. "Healthcare restoration is one of them." She reviewed his heart display readings, satisfied with what she perceived. "Yet, you're progressing remarkably admirably. Your willingness to fight, to survive, that created the distinction." Patricia reached, her vision glistening. Dr. Vasquez, I can never appreciate enough. When Dr. Thornton stated it was finished, you granted us optimism. You granted us a miracle. I granted you an opportunity, Elena stated. Marcus accomplished the remainder. She regarded the young man on the treadmill, living confirmation that refusing to acknowledge defeat could create possibilities where none had occurred. This is why we accomplish this labour. Instants like this. Later, Eleanor positioned in her fresh chamber, examining proposals for expanding the innovative heart operation program. Applications from physicians desiring to instruct with her filled 3 document folders. Requests for consultation on complex situations arrived daily. What had commenced as one impossible operation had expanded into something larger than she'd imagined. Her device vibrated. A communication from Cole Jenkins, the emergency medical technician who'd identified her in the crisis room that crucial night. Doc, secured a circumstance. Rural medical facility in Vermont possesses a heart trauma situation. They're stating it's impossible. Sound recognizable? They're inquiring for you. Elena regarded the communication, then at her schedule. Tomorrow she was instructing, the day after consulting on 2 complex situations. The week after that, presenting at a national heart operation conference. Yet this communication was about a patient who required somebody willing to perceive possibility where others perceived impossibility. She typed her response. Transmit me the situation particulars. I'll consult remotely and guide them through it. If necessary, I'll fly out tonight. Because that's what this labour signified, not merely executing miracles herself, yet instructing others that miracles were achievable, multiplying her impact beyond what one physician could accomplish alone. That evening, Dr. Thornton discovered her in the heart intensive care, examining patient documents. He'd become not merely an associate, yet a mentor who'd mastered as much as he instructed. Eleanor, he stated, the committee desires to expand your program nationally. Partnerships with 10 major healthcare facilities, federal funding through National Institutes of Health. You'd be instructing hundreds of physicians in field-adapted approaches. That's numerous administration, Elena stated cautiously. Numerous assemblies, committees, bureaucracy. It's also numerous existences rescued, Thornton disputed. Every physician you instruct will transmit your approaches to their medical facilities. Every patient they rescue utilizing your methods multiplies your legacy. Elena contemplated the child in Yemen, about Marcus Webb, about all the patients awaiting for somebody willing to attempt when others had surrendered. My legacy isn't about numbers, she stated eventually. It's about altering how we contemplate impossible, instructing physicians that innovation matters as much as guideline, that background from unconventional sources possesses merit. Then instruct them, Thornton stated plainly. Reveal the world what you revealed us, that sometimes the most significant healthcare advances originate from the most unexpected locations. 6 months post-transplant, Marcus Webb redirected to St. Michael's for his concluding major examination. His transplanted heart had integrated flawlessly. His heart operation was normal. By every measure, he was a healthy teenager with his complete existence ahead of him. Eleanor executed the examination herself, recording with contentment how distant he'd originated from that night in the crisis room when everybody else had stated it was finished. Your heart operation is outstanding, she communicated him. Pumping efficiency is 60%. No indicators of rejection. Flawless pattern. You're cleared for normal functions, including competitive basketball. Marcus's grin could have illuminated the complete medical facility. I'm going to execute college basketball, Dr. V. Perhaps even proceed professional. All because you didn't surrender on me. All because you were worth fighting for, Elena corrected. Remember that, when you confront disputes in your existence, remember that impossible is merely another phrase for not attempted yet. As Marcus and his mother departed, Eleanor redirected to her chamber, where a small collection of items had accumulated over the months. A photograph from Marcus revealing him in his basketball uniform. A letter from one of the children she'd rescued in Yemen, now a healthcare student. A record from Dr. Thornton that plainly stated, "You altered how this medical facility contemplates healthcare. Appreciate." These were the measures of achievement that mattered, not publication releases or awards. Existences rescued, futures created, possibilities comprehended. Yet, Eleanor recognized this was merely the commencement. Across the healthcare world, countless patients were being communicated their situations were impossible. Countless physicians were acknowledging conventional boundaries without inquiring whether other approaches might operate. The labour she'd commenced at St. Michael's was dispersing, yet there was so much more to accomplish. What occurs when healthcare ceases introducing? When guideline becomes more significant than patient results? When we acknowledge impossible as concluding instead of disputing it? Elena Vasquez's narrative is one answer, yet there are countless other healthcare professionals fighting comparable conflicts, challenging comparable boundaries, refusing to acknowledge that some patients are beyond rescuing. Their narratives matter. Their innovations could rescue existences. And by selecting to master from them, to sustain unconventional approaches, to merit background from unexpected locations, we create a healthcare community that rescues more existences, assists more patients, and never ceases challenging the boundaries of what's clinically achievable. If this narrative inspired you, share your contemplations in the remarks below. Have you encountered circumstances where innovation mattered more than guideline? Where somebody refused to acknowledge impossible as concluding? Our community merits you accepting this journey with us. Your duration matters. If this narrative navigated you, we possess more tales of healthcare innovation, impossible situations, and physicians who refuse to surrender. Why not explore another journey right now? And if you desire to secure confident, you never overlook our subsequent inspiring healthcare narrative, follow and strike the notification signal. We'd be honoured to welcome you into our community. Until subsequent duration, remember, impossible is merely a dispute awaiting for somebody courageous enough to attempt. Appreciate for being here with us tonight.